Hello students, we'll discuss a few instruments continuously which are very commonly used in day-to-day surgical practice. Briefly, I will highlight about each instrument one by one. Just to go through it and be concentrate on that so that try yourself to identify these instruments. So what are the parts of surgical instruments? See that these are the blades. This is the joint. See that? So it is like this. It can be boxer type, it can be screw type. Different. This is called a shaft. This is called a shaft. This is ratchet which catches and holds, and these are called as finger bows. Finger bows. So the finger bows, ratchet, shaft, joint, box, blades. See, this is how this part in magnified view is like this. So this is another type with the screws. How exactly? Sometimes how joint will look like. Cheetle forceps is the one which is used in the OT to hold. It's a very stout instrument without lock to hold the instrument and sterile instrument to bring from one table to other, or bring from the sterile tray table to the OT table whenever surgeon asks. So to transfer the sterile instrument, this instrument is used. Just look at how it looks like. See that no lock here. It's a very stout instrument. And tip is, see that there is a jaw here. So you hold the instrument like this and drop it. So that is the typical cheetle, CHEATLE. There is another cheetle cut is there in the intestinal anastomosis, where if there is adequate uniformity is not there, equality is not there in the cut end, one point you can cut it like this, so that equality you can make equal size. So that is called cheetle's cut. This is called cheetle's forceps. So remember both cheetle's cut and cheetle's forceps. This is used in the OT or in sterile area or in surgical ward also. This tip is dipped in the sterile solution so that it is aseptic. It is actually sterile. In the aseptic solution it is dipped so that you can always take and hold instrument, carry, so that instrument is not contaminated. That is the idea. This is cheetle's forceps. Remember, it's very commonly used. So this is sponge holding forceps. Ramply is sponge holding forceps used in the surgery. Before doing surgery, before draping the field, surgical field, you have to clean the field. Usually using povidone iodine or other thing, sometimes spirit, sometimes saline. So to clean the area, you have to use sponge or gauze. So to hold the gauze, you have to have an instrument. So this is the instrument. This is like a tip is like this, serrated here. So it grips very well, approaches well. It holds the gauze or sponge very well. There is a lock also here. So this is an Ramply sponge holding forceps. See that? See, look at that. This is the tip, how close or how open it is. Ramply sponge holding forceps. So that is to clean and clean the area before draping. So artery forceps is a very essential instrument in surgical field. Without that, you can't do dissection to hold bleeder, to catch bleeder. Sometimes to hold the needle holder for some purpose, to hold the ligature, to hold the tail end of the suture material. Artery forceps is very, very useful. Small sized, medium sized, large sized artery forceps are available. Straight and curved artery forceps are available. Small forceps are called as mosquito forceps because it is said that you can hold the proboscis of the mosquito. That's why it's called as mosquito forceps. Halstead forceps, otherwise it is called as. So different types are available mainly for dissection. Small fine dissection to gross dissection also is done using the artery forceps. Artery forceps should be held between the thumb and ring finger. Always all instruments should be held with the thumb and ring finger. The surgical fingers, thumb and ring finger, remember. So this is the artery forceps, medium-sized curved artery forceps. Within the distal jaw there are transverse serrations. So it gives a very good grip. So small mosquito forceps, this is a small mosquito forceps I said. Mosquito forceps size is small, that's why it's called as mosquito forceps. Again for small dissection. So dissecting forceps are the dissect, hold like a pen to dissect. So hold the tissue, hold the tip, hold the skin edge, hold the tough structure so that you can do the dissection, scissor dissection, artery dissection, whatever it is. So you got a non-toothed forceps that is mainly to hold the fascia, bowel, vessel wall. You got a toothed dissecting forceps. You got serrations here. Look at that serrations here. The serrations makes you have a proper grip of your fingers, like a pen you would hold, like this you would hold. This is how exactly hold the dissecting forceps. Now tooth are mainly told the skin and tough structures. So Alice tissue holding forceps, again very useful instrument to hold the skin flap, to hold the tough structure, to hold the aponeurosis and so on. But it is a tip is, there is a reposing teeth in the tip of the distal jaw, and like this it opposes, like this opposes. So it is traumatic. So we cannot use that one to hold bowel, vessels and muscles or delicate structures, because it will tear, it will injure and so on. Aponeurosis, tough structures, rectus sheath, skin flap can be held with this. So again, very useful instrument in day-to-day surgical practice. Without that, we can't do surgery properly. We got small size, medium size, large size also. In hysterectomy, you can hold the vault or vagina wall, upper part, proximal part, you can with this. So anywhere, tough structures are held with this. Grip is very good. See, this is the opposing teeth here, like this, and distal jaw, box here, joint here, ratchet here, finger bones, proximal part. Babcock's force is again similar, but it has got a tip, has got a curve, distal blades are opposing. There is a curve in the tip, there is an opening called fenestra, triangular opening, and tip of the Babcock's forceps is smooth, with smooth serrations. So it's atraumatic. Alice is traumatic. Babcock's is traumatic. That point you have to remember. It is mainly used to hold GI, esophagus, stomach, duodenum, and any system, tubular structures, vas deferens, appendix, small bowel, large bowel, rectum. Everywhere, GI, this instrument is very essential. Remember, there is a fenestra and belly curvature in that. So this is look at that. This is the curvature is that, and tip is like this, smooth serration. And if you look at that, there is a triangular fenestra, so that bowel will bulge, so it will not get crushed with that. So this is the Babcock's. You should know the difference between the Alice forceps and Babcock's. It's atraumatic. It's traumatic, mainly for bowel and delicate structures. That is for tough structures, remember. So students, please go through my clinical examination method with the lectures and examination videos. Go through my SRB's manual of surgery, operative procedure where drainage is there, operative procedure by different procedures are there, and tissue approximation. Of course, my did you know video lecture through JP, everything is there from A to Z, operative surgery, instrument, pathology specimen, neurosurgery, cardiothoracic, general surgery, gastrosurgery, everything is there. So please go through that. So that is also go through my surgical SRB Surgical Insight website and related online materials. So students, I hope you understood this lecture very well. Thank you very much.